with collaborative research in the European research area. Thank you for your comments. I have forgotten to put up my microphone. Now you can hear me once again. This is Julian Drausinger speaking, food technologist from the Food Research Institute in Vienna. We are doing very applied services for the food industry, and we are also a good cooperation partner of the academia side in a lots of number of EU R&D projects. Today's webinar will be about nutrition and health aspects correlated with food, which means the labeling of foods due to nutrition and health claims aspects. In this webinar, we would like to say how to communicate nutrition and health claims for food products. We will go in deep detail in the EU health claims legislation 1924/2006. And also we will give an eye and the focus on the condition of use of prohibited claims as well as mandatory claims, which are also present. And of course, you will see some examples for the transport of health claims on foods in Europe. Before we will start, I will give you a small agenda and introduction about technical aspects of this webinar so that you are able to be clear with all the types and buttons of the GoToWebinar system. I will give you a small introduction about the FoodStar project, because the EU FoodStar project is financing this webinar. You know, it's for free, so we will leave some small minutes on this. Of course, then this will come what you have been waiting for, the presentation of Caroline. And after the presentation, we will answer your questions. Questions will be done in written form. I will explain this on the next slide, how you can do this. Questions in written form. You will also have the possibility to give a waving hand for any emergency. I would suggest that we leave the waving hand just for technical problems, and later on, if you have questions, please do them in written form, because we are up to 30 participants, and if all of them would talk around each other, this would be a huge mess. When we have ended the webinar, you will have the possibility to give an evaluation directly after the webinar has finished with an on mask. You will also have the possibility to give feedback via email, because in 2-3 hours time you will receive a feedback email where I can give the same feedback you also have been given on the webinar space. So having a look at the control panel, here you can see what you can see on your control panel as well. On the bottom, you have an area to post questions, so please use this area if you have questions during the webinar. I will collect them all, and after the finalization of Caroline's speech, I will hand over these questions to Caroline, and we will answer them one by one. So please, we will collect the questions. So if there are any questions, please post them in the question area. If you would have to have a full view of what Caroline is going to present, you can minimize the panel there. So the main part of the control panel will go away, and you just have this minimized area there. If you want to have it in full screen, you also have the possibility for full screen. This is what I mentioned with the raising hand. I can see on my second screen all the participants in the list. So if anybody raises the hand, I can see it there and can get into contact with you. But please, once again, just use it for IT, internet technical problems. If you want to post questions, please use the area below. Your micros are muted for a good cause. As I mentioned, we have more than 30 participants. So please leave your micro muted. Or again, I can see if your micro is muted in my list. If you unmute it, I will mute it once again, because we would like to keep it quiet for Caroline. If you have to leave earlier, if you face some technical problems, you cannot follow the whole presentation, the session will be recorded. And at the end, I will show you on the FoodStar webpage where you can have access to the recorded version. Or if you like it very much, you can see it there once again. So now we are going to the FoodStar project, which is the basis for this series of webinars we are carrying out and which finances these webinars. It's an Erasmus Plus Knowledge Alliance project lasting until the end of 2017. We are a number of project participants all over Europe which have the same vision, which share the same vision to build a bridge between the science, the universities, and the industry and their needs on the other side. We have been dealing with this problem, I think, about more than 15 years right now in our institute. We still have not found a patent solution, but I think we are coming more and more stepwards towards it. We have the universities, the science community at the one side, who are obliged to disseminate, to have publications, because then the ranking, of course, the scientific ranking is higher. You have to find third-party financing, and of course, researchers want to do research. Researchers want to go into deep and have the solution for fundamental mechanisms. The industry, on the other side, have no time. They have some money, but they need fast, efficient, and working solutions. And of course, if a company has found a solution, it wants that the solution sticks for them and not for the rest of the world. So we have some inconsistencies between the sides of the world, between the scientific and the industry side. And this gap we want to overcome with mediator functions, with bridging the gap with concrete mechanisms and projects. And our vision is that the food industry and the universities will go together in the food star system for a long-term partnership. We do not want to have an end at the end of 2017 when the EU financing is gone. We want to have a long-lasting system with our physical hubs. I'm going to explain later on for a direct contact for the industry and the scientific side to have very fast and efficient solution solving ways to have exploits and financial and competitive gains for the industry based out of the findings we find at the researchers' side in the scientific community of the universities. So who is there? We have loads of Europe in this project. We have 7 universities, 3 food companies, and 11 multipliers carrying out this mediating, bridging function, and also these training programs you are now also taking part of. We have the University of Applied Agricultural Sciences in Vienna as coordinator. We have another 6 universities throughout Europe taking part from the scientific side. We have a Portuguese company called Frulact, which is a worldwide operating company dealing with fruit preparations and flavorings. We have GB Foods from Spain, also acting worldwide with lots of subsidies in the food business. And as a accompanying partner, we also have a very small Swiss company called Nestlé. Maybe you have heard of them from time to time. Multipliers and training providers are the backbone of the project, so institutes like us are being part of this project. We also have partners in France, we have partners in Italy, Spain, Greece and Portugal. We have the ISEKI-Food Association network in the back, so this multinational worldwide acting network of ISEKI helps us a lot in the distribution of our issues and tasks. We are collaborating with EFOST for the industry side, and for the student approach we are collaborating with Eroica, and a network of more than 15 food federations called Spread European Safety is also an interested partner of this project. What you see here is a network of physical hubs which are going to be implemented throughout the project in its lifetime. We do not want to have a virtual architecture nobody can touch. We are going to implement real physical hubs in all of the partnering countries, from Vienna, Hohenheim, Paris, Leeds, Porto, Teramo in Italy, Barcelona in Spain, and Athens in Greece. So you can see us there, you can watch us there, you can touch us there, you can talk with us, you can exchange your views and your results with us. So please contact us so that we can bring loads of industry and loads of scientific community people together. Contact us, this is the right word for the next slide. This is our email address, office@isekifood.net. So if you have any comments for this webinar, if you have any comments for the project, or if you want to be part of being interested in the project and its results, then please contact us via this email address. And now we come to what you have been waiting for, to the presentation of health and nutrition claims for foods based on the European legislation. Caroline Roberol, I hope I spelled it in the right way, is working in a French institute which covers more or less the same tasks as we do in Vienna. It's a very applied institute, doing a lot of trainings, doing a lot of support for the industry. In a very nice region, she's working in the Haute-Provence-Alpes-Côte d'Azur. So congratulations, Caroline. An area where other ones are going to holiday, you are going to work. Very well done. And she is very experienced in training on this legal stuff of food labeling. She is also very active in editing. She has made guidelines. She was co-editor of guidelines in France for the labeling of nutrition and health claims. And now we would like to profit from her knowledge, from her expertise. And I would now like to hand over the screen to Caroline and to start the presentation. So, Caroline, the screen is yours. Caroline, you are assigned as moderator. Can you hear me? Perfect, it's there. So, Caroline, I would now ask you to unmute your microphone so that we can hear you. I've done it for you, so now it should be active. And I would kindly ask you to start your presentations. We are quite well in time. We have 40 to 45 minutes for your slides, and we are very eager to see your opinion on the issue on legal labeling for nutrition and health claims in foods. Hello, you can start.
Hello.
We can hear you.
Hello. Good afternoon, everybody. Before I begin, I would like to say that I'm very pleased to speak to you, and I would like to thank you for your interest. I would also like to thank the partners involved in the European project FOODSTAR and the organizer of the webinar. Just a few words about myself and the network of ACTIA called NutriPrevious, of which I am an active partner. This French nutrition network of ACTIA had the objective to provide companies, technical centers, and training organizations approaches and tools for first determining the nutritional composition of the products by calculation and or analysis, second, evaluating nutritional quality, and thirdly, improving composition and control. Today, the aim of my short talk is to understand how nutrition and health claims, like low fat, for example, work in Europe. I will speak for about 30 minutes presentation maximum. After that, we have time for questions. Don't hesitate to ask questions. I've divided my talk into two main parts. The bigger parts will be about how to communicate nutrition and health claims for food products. We'll see together definitions and scope of European Regulation 1924/2006. Then I will talk about condition of use of each category of claims and those which are prohibited, and my talk will be illustrated with examples. In a short second part, I will explain to you the link between nutrition and health claims and mandatory nutrition labeling. Okay, let's begin with the first point, which is how to communicate nutrition and health claims for food products. The regulation has the number 1924/2006. This new European regulation became law in January 2007. It was corrected by a corrigendum and amended by 5 regulations to date. In order to include these corrections and amendments, it's necessary to download the consolidated text on website EURLEX. The text is divided into 29 articles, and an annex, which is a list of nutrition claims authorized and conditions applying to them. As a reminder, the Regulation 1924/2006 has been applied since the 1st of July 2007. The great change introduced by this regulation is that since this date, all nutrition and health claims have to be authorized before being placed on the market within the community. Before this date, nutrition and health claims were controlled by the national authority with the rules of each country. This regulation has several goals. First, contributing to a high level of consumer protection and facilitating their choice. Second, establishing community rules in the European Union and harmonizing the national rules between the different member states. Thirdly, ensuring the effective functioning of the internal market and free movement of foods. Also, creating equal conditions of fair competition in Europe, and promoting and protecting innovation in the area of food. Regulation 1924/2006 applies to the use of claims, which are any message or representations which is not mandatory under community or national legislation, including pictorial, graphic, or symbolic representation in any form, which states, suggests, or implies that a food has particular characteristics. In particular, the regulation applies to the use of nutrition claims, which are any claim where particular characteristics or particular beneficial nutritional properties due to the energy and or the nutrients or other substance. It's, for example, low fat, sugar-free, source of fiber, or high protein. The regulation applies to the use of health claims, which means any claim that states, suggests, or implies that a relationship exists between a food category, a food, or one of its constituents, and health. It will be, for example, calcium is needed for the maintenance of normal bones. This regulation applies to nutrition and health claims made in commercial communication, which are delivered as such to the final consumer or mass caterer, such as restaurants, hospitals, schools, canteens, and similar. This regulation applies to prepacked and non-prepackaged foodstuff. For the latter, Article 7 and Article 10.2.a and b shall not apply. The regulation applies to trademark, brand name, or fancy name, which may be construed as a nutrition or health claim. They may be used without undergoing the authorizations procedure, provided that they are accompanied by a related nutrition or health claims authorized. The regulation applies without prejudice, which means in addition to the other European provisions relating to foodstuff for particular nutritional uses, waters, and food supplements. The use of nutrition and health claims mustn't be false, ambiguous, or misleading, give rise to doubts about the safety and or the nutritional adequacy of other foods, encourage or condone excess consumption of a food. The use mustn't also state, suggest, or imply that a balanced and varied diet can provide appropriate quantities of nutrients in general. And the use mustn't refer to changes in bodily functions which could give rise to or exploit fear in the consumer. For example, it's forbidden to show weight gain without consumption of a product. The following health claims mustn't be allowed. First, claims which suggest that health could be affected by not consuming the food. For example, a few years ago, an advertisement was banned because there was a healthy old lady who consumed yogurts of the brand and another lady who didn't and broke her leg. The following health claims mustn't be allowed. Also, claims which make reference to the rate or amount of weight loss. For example, it's forbidden to say or write 5 kilograms less in a week. Claims which make reference to recommendation of individual doctor with his or her name is forbidden, or else professionals and other associations not referred to in Article 11. Article 11 indicates that national associations of medical, nutrition, or dietetic professionals and health-related charities may be authorized to make recommendations. It's, for example, the case in France of Pasteur Institute, Lille. A reference to general non-specific benefits of the nutrient or food for overall good health or health-related well-being may only be made if accompanied by a specific health claims authorized. Food information mustn't attribute to any food the property of preventing, treating, or curing a human disease, nor refer to such properties. It's forbidden to attribute medicinal properties to a food. Since the adoption of the regulation in 2006, the implementation of the regulation remains incomplete since nutrient profiles that had to be set by January 2009 have not been established. These are specific nutrient profiles which food or certain categories of food should have conformed to in order to bear nutrition or health claims. They should be established taking into account, in particular, the quantities of fat, saturated fatty acid, trans fatty acid, sugars, and salt, for example. Currently, there is an evaluation of European legislation on nutrition and health claims by the European Commission, and an online consultation has been launched about nutrient profiles. In all cases, there should be derogations. We are going to look at the other condition of use, nutrition, and health claims. First, the presence, absence, or reduced content in a food or category of food of a nutrient or the substance in respect of which the claim is made has been shown to have a beneficial nutritional or physiological effect, as established by generally accepted scientific evidence. Second, the nutrient or other substance for which the claim is made is contained in the final product in a significant quantity. This quantity was defined in legislation or in a quantity that will produce the effect claimed. The nutrient or other substance for which the claim is made could also be not present or present in a reduced quantity that will produce the effect claimed. The quantity of the product that can reasonably be expected to be consumed provides a significant quantity of the nutrient or other substance to which the claim relates. Thirdly, the nutrient or other substance for which the claim is made is in a form that is available to be used by the body. The average consumer can understand the beneficial effects expressed in the claim. Nutrition and health claims must refer to the food ready for consumption in accordance with the manufacturer's instructions, and nutrition and health claims must be compliant with the specific conditions of the regulation. There are particular conditions of use for beverage containing more than 1.2% by volume of alcohol. Health claims are forbidden, and only nutrition claims referring to low alcohol levels or reduction of the alcohol content or the reduction of the energy content are authorized. Now we'll look at specific conditions of nutrition claims. Nutrition claims are only allowed if they are listed in the annex of the regulation 1924/2006. The annex was amended 2 times. On the following slide, you can see all nutrition claims authorized and conditions applying to them. You can consider that there are nutrition claims which are negative, such as fat-free, because they deal with the absence or reduced quantity of a nutrient which is considered as negative, or calories. But on the other hand, it means that there are positive nutrition claims, such as a source of or high fiber or protein. For example, a claim that a food is a source of or is high in protein, and any claim likely to have the same meaning for the consumer, may only be made where at least 12 or 20% for high of the energy value of the food is provided by protein. A claim that a food is a source of or high vitamins and or minerals may only be made where the product contains at least a significant amount defined in the annex to Regulation 1169/2011. This significant amount is 15 or 30% of the nutrient reference values specified in the Regulation 1169/2011, supplied by 100 milliliters or per person. But in the case of beverage, it will be 7.5% of the nutrient reference values supplied by 100 milliliters. In the same annex, you can find a category of nutrition claims called comparative claim. Comparative claims must compare the composition of a food with a range of foods of the same category, which don't have a composition which allows them to bear a claim, including foods of other brands. The difference in the quantity of a nutrient and or the energy value must be stated, like 50% less sugars or like no sugars. The comparison must relate to the same quantity of food, and in such a case, the products being compared must be clearly identified to the final consumer. Now, we'll look at specific conditions of health claims. There are three categories of health claims. First, health claims of Article 13.1. Second, health claims of Article 13.5. And thirdly, health claims of Article 14. Health claims of Article 13.1 and 13.5 are called function claims, which means health claims describing or referring to the role of a nutrient or other substance in growth, development, and the functions of the body, or psychological and behavioral functions, or slimming, weight control, reduction in the sense of hunger, or increase in the sense of satiety, or the reduction of the available energy from the diet. It will be, for example, calcium is needed for the maintenance of normal bones. Health claims of Article 14 concern reduction of disease risk claims. It's, for example, calcium helps to reduce the loss of bone mineral in postmenopausal women. Low bone mineral density is a risk factor for osteoporotic bone fractures. The second category of health claims of Article 14 concern claims referring to children's development and health. It will be, for example, calcium is needed for normal growth and development of bone in children. Health claims shall only be permitted if information of Article 10.2 is included in the relabeling, or if not such labeling exists in the presentation and advertising. Health claims of Article 13.1 are said to be generics and based on generally accepted scientific evidence. They are authorized only if they are listed in the Regulation 432/2012 and are in conformity with the conditions set out in this regulation. They can be made without undergoing the procedures laid down in Articles 15 to 19. The claims must refer to an ingredient, nutrient, or substance that cause the effect and not to the finished product. The nutrient or the substance causing the effect must clearly appear in the wording of the claim. It should not be assumed that the product carrying the claim is responsible for the effect. For example, calcium is needed for the maintenance of normal bones and not the yogurt, which has a specific composition in fat and sugar, and for example. Else claims for a finished product containing more than one active ingredient should be the subject of a specific claim procedure like the following. Else claims of Article 13.5 are said to be specifics because they can concern a specific form of calcium, for example, or a finished product containing more than one active ingredient. They are based on newly developed scientific evidence and/or which include a request for the protection of proprietary data. Unless I am mistaken, there would be only 4 claims Article 13.5 authorized. It's little. For reduction of disease risk claims, a statement is mandatory in the presentation or advertising indicating that the disease to which the claim is referring has multiple risk factors and that altering one of these risk factors may or may not have a beneficial effect. For this reduction of disease risk claims and claims referring to children's development and health, an application for authorization must be submitted and sent to the national competent authority of a member state, which will inform the authority, the European authority, and the European authority will inform the other member states and the Commission. Some guidelines exist concerning the preparation and presentation of the application by the Commission. An application for authorization is necessary for health claims of Article 13.5 and 14. The procedure includes first an opinion of the European Food Safety Authority, then a community authorization. Any health claims made on food should be scientifically justified in order to protect consumers from inaccurate or misleading information. The role of EFSA, and in particular of its scientific panel of nutrition, dietetic, products and allergy, is to review the science behind all these claims. How does EFSA perform this task? In assessing each claim. EFSA nutrition experts focus on 3 main criteria. The first criteria is the food or food ingredient properly defined for the claimed effect. For example, a claim on weight reduction might be proposed for all dairy products like yogurt, milk, and cheese products. This food category wouldn't be sufficiently defined for such a claim, as there are so many different types of dairy products on the market which may have a different nutritional composition like full fat, low fat, sugar or nut, which could have a different nutritional different effects on body weight depending on their composition. But yogurts with a specific composition in fat and in sugar, for example, could be sufficiently characterized. The second criteria is the claimed effect properly defined. For example, a claim stating that a food improves your body shape is too unspecific for a scientific evaluation, but the claim stating that a food helps to reduce your body weight, for example, is sufficiently defined because body weight can be measured. If criteria 1 and 2 are met, then the EFSA's experts look at all the data available to see whether there is sufficient evidence to substantiate the claim. In this context, human intervention studies are crucial for the evaluation of whether the claims can be scientifically proven, but also other studies can provide useful supportive evidence. For example, on how this could work, the studies need to address the defined food. In our case, it would be the yogurts with specific defined composition, and the right outcome, which could be, in our case, weight reduction. At the end, the panel looks at the number of studies in favor and not in favor for the claim, also taking account the quality of the studies and the plausibility of the claim, and then weighs the overall evidence to come to a conclusion. The conclusion can be positive, which means that the panel is convinced that there is sufficient evidence to substantiate the claim, or negative, which could mean that there is either some but not convincing evidence, or there is only poor evidence, for example, no human study at all to prove the effect. On the basis of EFSA's scientific work, the European Commission and Member States decide on whether or not to authorize the claim. Then, the European Commission informed the applicant of the decision taken and published details of the decision in the official journal of the European Union. The Commission maintains a community register of nutrition and health claims made on food, which is available to the public. It includes the nutrition claims and the conditions applying to them, restriction, the authorized health claims and the conditions applying to them, a list of rejected health claims and the reasons for their rejection. Health claims authorized on the basis of proprietary data shall be recorded in a separate annex to the register. Since the adoption of the regulation in 2006, the implementation of the regulation remains incomplete since there are a lot of transitional measures. For example, products bearing trademarks or brand names existing before the 1st January 2005, which don't comply with this regulation, may continue to be marketed until the 19th of January 2022, after which time the provisions of this regulation shall apply. In a press release in 2010, the European Commission announced a major change in the procedure for the adoption of lists of generic health claims authorized, with the adoption of two separate lists. One for all nutrition and substance, which is now the regulation 432/2012, and another for plants, called pending list. So, for example, in France, the French provisions based on post control continue to apply. Health claims of pending list are tolerated until the list of health claims has been adopted and can be used under the operator's responsibility, provided that they comply with this regulation and national regulations. The use of health and nutrition claims triggers an obligation to provide nutritional information in accordance with Article 7 of Regulation 1169/2011. Or in the case of food supplements, the nutrition information shall be provided in accordance with Directive 2002/46. Nutrition labeling of products on which nutrition and/or health claim is made shall be mandatory with the exception of generic advertising. The information to be provided shall consist of that specified in Article 30.1 of Regulation 1169/2011 in a mandatory tabular format like you see on your screen. In addition, where a nutrition and/or health claim is made for a nutrient, referred to in Article 13.2 of Regulation 1169/2011, the amount of that nutrient shall be declared. But the amount of the substance doesn't appear in the nutrition labeling, not in the tabular format, but shall be stated in the same field of vision as the nutrition labeling, like you see on your screen. The units of measurement used to express the amount of the substance shall be appropriate for the individual substance concerned. the reference used and or recommended to read are the followings. And finally, I would like to thank you again for your attention. I will try to answer your question. However, I probably will need more time in certain cases in order to look for specific reference and have sufficient time to think about each reply. So I commit myself to answer you in writing in either case. My English will also be clearer this way. If anyone speaks French, please don't hesitate to send me your questions in French. Thank you very much.
Thank you very much, Caroline, for this very interesting presentation about the status quo we do face in Europe for nutrition and health claims labeling on food. I will now take back your screen to me. So this means now your screen isn't visible anymore. And so now you can take your PC as you are used to any time. We have received 2 questions. I will forward to you right now. First, I just want to say that the status of health claims in Europe is a very critical one seen from the side of the food industry. I also see that 2 friends of me from FDE science and research expert groups are under the participants of today's webinar. We are working very hard there and FDE to make it a little bit more easy for the food industry to state such claims. But in the moment, you can say you need loads of patience, loads of time, and loads of money for any studies or any substantiation which is obliged for EFSA. Caroline, I will now forward you the first question, which was stated from Sam Multari. I will also read it that everybody can hear it, and I'm eager to hearing your answer later on. The question he states is, do different countries have different claims, or are the nutritional claims the same throughout Europe? So the basic question is, do we have a standardized European procedure, or do we have national specialities in Europe for the claims?
This regulation is the European regulation. I'll talk about regulation 11911. Sorry, just a second. The exact number. I think about the regulation 1924/2006. Is a European regulation, so the country in Europe have the same claims. The nutritional claims are European.
And thanks for God that it is so. Yeah. A backdoor for this could be if nutritional profiles will be put in reality in the near future or not. At the moment, I do not have any hint that nutritional profiles will be stated. Do you have any further information about the status of the development of nutritional profiles, or is everything pending right now?
Sorry, I haven't read the question. Do you have?
Okay. This was an additional question from my side.
Okay.
Do you have any information about the status of the development of nutritional profiles, where we are right now? Are we just at the start as in 2009, or are there any further developments which have taken place right now?
About nutrient profile, what I know is that there is the famous evaluation currently, and online consultation has been launched about them. So we are going to know in several months, I think, what will be the nutrient profiles. The systems selected in order to choose which claims will be authorized, and what we know is also there should be derogations. For example, I look for example. Sorry, I look for the text deals with two derogations. First, nutrition claims referring to the reduction of fat, saturated fatty acid, trans fatty acid, sugars, and salt will be allowed without a reference to a profile, provided they comply with the conditions in this regulation. And the second derogation will concern nutrition claims where a single nutrient will exceed the nutrient profile, provided that a statement about a specific nutrient appears in close proximity. You can imagine a sweet which is fat-free but rich in sugar, and a statement in close proximity like high in sugar. It will be authorized to bear nutrient claims, but to indicate also there is high content in sugar. So it will be very sexy.
Okay, let's see. Okay, I forwarded you another question from Samuel Tari. He says, some food companies claim that their products have probiotic effects. However, these effects are real only at the moment of production or very soon afterwards. After weeks, the products are still on the market at the same price but do not perform the health claim. Is the EU working on this issue? So I suppose that the background of the question is, are some health claims allowed for probiotics at the moment, or isn't any claim substantiated by EFSA? So what is the status for probiotics right now? Are companies allowed to give additional information on this on the label, or aren't the claims substantiated?
The effect of product with health claim must be confirmed in a ready consumption form. That's what I said. Nutrition and health claims must refer to the food ready for consumption. So my first answer is yes, this regulation works with the product, with this product and this issue. The effect must have to be real after when the consumer consume the product. The issue with probiotic, I think, is often the issue of characterized probiotic, because there are several variety of probiotic bacteria, and it's difficult to well characterize the probiotic which is contained in the product, and to relate them to effect.
Okay, thank you very much. I have forwarded you the last question by Qin Yi Yuan Huan. Sorry for my pronunciation. He says, thanks very much for the presentation. There's one question regarding claims for micronutrients. As far as I know, to claim any micronutrient source of mineral or vitamins, you're usually based on normal adults' RDAs, according to the annex of Directive 9496 CE. However, if we are developing a new product targeting elderly people, their RDA is logically much higher. The same happens if we want to develop a product for kids. So is it possible to make claims on specific targets' needs for micronutrients? Is this legal or not?
I think the answer is in the scope of the regulation. The scope of regulation is Regulation 1924 applies to the use of claims and to commercial communication, which are delivered as such to the final consumer. So books without intention to sell a product may be not considered as a commercial communication. I think it's the thing of certain peoples.
Mm-hmm. Thank you. And there's a last question, a final question, so I would pass over to you. On the market, there are many books that state to provide the solution to overweight, obesity, and depression. Most of these books are not supported by any scientific evidence. Why is the regulation not applied also to kind of books? So the question states, why do we have such a kind of regulation for foods? But on the other hand, you can tell everything you want in books or publications. Is the health claims regulation also affected to public editings, or is it just limited to the labeling of the product?
Sorry, I think I was mistaken because I have answered this question. I think. Sorry, I don't see the question, so it's very difficult to answer.
Okay, sorry, I will forward it once again. So the base, the essence of the question was, you have these limitations or legal obligations for labeling of food. On the market, he says there are loads of books, not, you can say scientific or not, books for overweight, obesity, depression, and many of these books are not supported by any scientific evidence. So why, he states, why is it possible that you can buy such kind of books with this kind of information on the market where you are not allowed to state such a kind of information on foods? So is there any correlation between labeling on food products, also on public editings or publications, or is the health claims regulation only limited to the labeling of foodstuffs on the foods itself?
Sorry, but the question I have seen is the same question I just answered. Is it on the market? There are many books that state to provide the solution. Yeah.
Yeah.
So I don't know what was the question before, because I have answered to this question before.
Okay.
So,
okay, sorry, then maybe it was a mistake of the system. It signaled me a new question. Maybe it was an old one. Okay, then sorry about this. I have no further question from the participants. So it is 2 minutes before 4 o'clock, so we are perfectly right on time. Thank you very much, Caroline, once again for your presentation. I would now just, as the final act, guide you as participants to the Foodstar webpage, which you can see on your screen. The internet address is www.foodstack.com. food-sta.eu. So there you can see any facts, backgrounds and information about our FoodStar project. And here in the middle at the button events, there's a subsections for webinars. If you click on it, you can see the upcoming and the past webinars. And our webinar of today, of course, will shift to the past webinars. And if you click on it until tomorrow or in 2 days in advance, you will find the recording of this webinar, and you can watch it once again if you would like to. So thank you very much for your presence. We had over 35 participants. Thank you very much for your interest. Thank you very much, Caroline, for your presentations. And I'm hoping to see you soon all together at one of the upcoming webinars of FoodStar in the near future. Goodbye and have a good morning, a good afternoon, and a good evening wherever you are. Thank you very much and goodbye.